Hello out there and thanks for joining. This is Marian Slamish from Pointr and we're very excited that you are here with us for today's webinar. I've got some great speakers with me today. We are all here to talk about smart hospitals. We are joined by best-selling author Paddy Padmanabhan from Damo Consulting. Paddy is an expert in healthcare technology. He has interviewed IT leaders at some of the largest hospitals in the country. And in this Lunch and Learn session, he will be able to provide a practical roadmap on how to digitize hospitals efficiently. Also with us today is Neeraj Nitin Jadhav, who is a senior research analyst at Frost & Sullivan. Has innovation accelerated or stalled because of COVID? Neeraj is the author of a very interesting study on how COVID has sparked digital innovation in US hospitals, and he will be able to answer that question. We've also got Caleb York here from technology provider Virtusense and Justin Bolger from indoor location company Pointr. They will give us concrete use cases on how technology has created great patient experiences, improved care, and optimized operations in US hospitals. Caleb will discuss remote patient monitoring in US hospitals in the light of COVID, and Justin will explain the benefits of real-time location technology. Each of our speakers will do a 5-minute presentation, and we will then have a lively panel discussion on smart hospital ROI, challenges, best practices. You have the opportunity to ask questions in the chat box, and the speakers will answer those after the session. But first, let's get some context. Paddy, can you tell us how US hospitals can successfully implement smart technology?
Thank you, Marianne, for having me on this webinar. We are going through a very interesting transition in healthcare, both in the way healthcare is accessed and in the way healthcare is going to be received and experienced going forward. And I hope to talk a little bit more about that as a part of this conversation. But as everybody knows, the pandemic has accelerated the adoption of virtual care models, which is a big trend. It has accelerated the consumerization of healthcare, especially online digital patient and member engagement. And it has accelerated the adoption of technology tools and platforms for transforming the healthcare delivery. So I think those are the three themes that we're going to be talking about as a part of this conversation. I'll walk through a handful of slides that outline the opportunity in front of us, the current state of digital transformation, and some suggestions for a practical approach to developing and executing a digital transformation roadmap. So quickly, I just want to spend a minute talking about who we are and what we do. Damo Consulting is a digital transformation and growth strategy advisory firm. We work with healthcare enterprises to accelerate their digital transformation. We help them develop digital roadmaps. We help them with technology strategies, technology partner selection. And we do that using a combination of proprietary frameworks and methodologies, and also with the help of an in-house database where we track the digital health initiatives of a number of health systems and the technology provider community. We also work with the technology vendor community in helping them with their growth strategy and through strategic marketing and thought leadership-led branding solutions. We have an affiliate company that helps with design and innovation. So that's who we are briefly. So let's jump right into what COVID-19 means for us today. COVID-19 has really accelerated the transformation of healthcare. And in many ways, COVID-19 has also acted as an equalizer in the marketplace for digital health transformation solutions. What we saw in the last 9 months was that many health systems implemented telehealth solutions in a very short time frame, because that was what was required when the pandemic forced everybody to close down physical facilities except for COVID-19 cases. But now that they have implemented telehealth solutions, they have to look beyond COVID-19 to develop and implement a long-term digital transformation roadmap. What we're seeing digital leaders adopt is implementation roadmaps that align with the strategic priorities for their enterprises. And these strategic priorities have to do with the transformation of the enterprise to a digital first healthcare delivery organization. CIOs in particular have to transform IT to support digital transformation at the back end, and technology decisions have to develop and deliver enterprise level impact instead of just departmental or functional priorities. And we'll come back to these themes during the course of the discussion. I want to share some data points from one of our consulting engagements with a large health system in New York City. This is an entity that engaged us to help them develop a digital roadmap. And as a part of that exercise, we did an internal survey for over 150 executives across functions and across departments. And the chart that you see here tells you what came up as the top priorities from the survey that we did. No surprises, real-time virtual consults came out to be the #1 priority. And we're talking about early summer when the pandemic was at its peak. And closely related to that was also the need for developing and delivering online access to a range of healthcare services, mostly to do with access, but also to do with healthcare delivery, which takes us to remote patient monitoring. And as you know, healthcare is shifting from the hospital to the home. And I know Caleb's going to talk a little bit more about this, but this is another important trend that is driving digital transformation. The need to take care of patients in their homes using remote monitoring technologies. And last but not least, improving the overall visit experience for anyone who needs to come into the hospital. This is representative of health systems across the whole, even though this is data for just one health system. We use a maturity model within Damo Consulting to really help health systems understand where they are in their current state when it comes to digital transformation. This is a 4-stage model. At model 1, health systems are really looking at just their EHR platforms to drive their digital strategies. Health systems move on beyond the EHR platform when looking at best-in-class solutions and tools when they are in model 2. And when they come to model 3, they're really investing in an organizational structure that can drive these digital initiatives, but with a specific focus on digital front door programs. And the most mature organizations are the ones that are taking a holistic approach to digital transformation and transforming both the front end and the back end of healthcare delivery. They're investing in a handful of strategic partnerships, and they're going about harnessing innovation in the digital health ecosystem in a very, very structured way. We actually have an assessment tool that many of our health system clients leverage to really understand where they are. There's a scoring model behind it, and we provide them with a report that tells them where they stand with regards to their own marketplaces and their peer groups, so they can appropriately develop their roadmaps and prioritize and reprioritize their digital programs. So how do you develop a digital transformation roadmap? And here is a framework that we use within the organization, and we have used this very effectively at health systems like the Cleveland Clinic, which is where we did an enterprise digital roadmap, which was the basis of my recent book, Healthcare Digital Transformation, which I co-authored with Ed Marks, the former CIO of Cleveland Clinic. But this is a framework that anyone can use. You can take this, you can customize it, you can modify it for your own needs. And I would encourage anyone listening to this webinar to really look at which parts of these are relevant and pertinent for your organization, and go ahead and leverage this framework for driving and developing your own digital roadmaps. There's really 3 phases to the roadmap development. Firstly, you need to assess your internal environment in terms of your current initiatives in progress, assess your own internal capabilities and your needs, and align it with what the marketplace needs. So you look at the macro trends in the market, whether it is your own geographical market or your peer groups, and then you do a competitive analysis and look at the technology trends that are driving digital transformation. And then you come up with a roadmap design that documents all the use cases and your needs. And then you prioritize and sequence them because you're not going to be able to implement all of them in, at the same time. And then you understand what the technology dependencies are, what the IT modernization needs are, and of course, last but not least, what your investment needs are. And then you go about implementing your strategy. So the strategy comprises of three parts. You have an IT strategy or the technology strategy. That includes both the internal IT org as well as the technology partner ecosystem. And then you have the partnership strategy that goes beyond EHR, but looks at the EHR as a foundation. Then you look at your digital health innovation ecosystem, as well as big tech firms and everyone in between that can help you achieve your goals. And then last but not least, how you govern your digital transformation roadmap. So these are the three main elements of implementing a roadmap. I highly encourage you to adopt this framework and customize it and modify it for your own needs. And I wish everyone can leverage it to really accelerate your digital transformation journeys. That's all I have as my initial comments, and I look forward to answering any questions. For those of you who are interested in my book, there's a link on the top. You can go in there, or you can go to my website and you can get signed copies of my book as well. Marianne, back to you.
Yeah, all very clear. I'm very interested in particular on how enterprises can prioritize this digital innovation, but we can address that in the panel discussion. But first, I'd like to hear from Neeraj and whether he shares this feeling that there is a real acceleration of digital innovation in hospitals. And Paddy, you mentioned patient experience and remote patient monitoring. Neeraj, do you see the same trends when you do research from your side?
Yes, absolutely. And I do agree with Paddy regarding the digital revolution that is occurring in the hospitals. And especially the COVID pandemic has been the key phase which has pushed the adoption among the hospitals, because the healthcare is a little bit hesitant to adopt new technologies as compared to different areas such as retail or the manufacturing areas. But in this pressing times, digital revolution has been hastened because of its utility and improved patient experience and the outcomes that it has delivered to the healthcare system as a whole. So I'll help you out with the how's the pressing needs in the healthcare system, and how the digital technologies can overcome these challenges. So let me give you an idea about it through my presentation. Yeah, so as I stated in the initial conversation, that COVID-19 has pushed industries over the technology tipping point and transformed several business models. There has been a rise in digital health technologies in the hospitals, also responding to the pandemic with increased adoption of these technologies to address some of the pressing issues. Now, in this slide, we'll talk about some of the unmet needs. So through our research, we have observed that there is a practice of intermittent monitoring of vital signs in the non-ICU settings. The devices used for monitoring are bulky and requires use of cables and leads for obtaining vitals, which can cause discomfort to the patients. Moreover, the current processes, such as appointment scheduling, require manual interventions, which lead to inefficiencies in patient workflow. What we have observed is during the COVID pandemic, the continued influx of patients in the hospital has led to difficulty in maintaining adequate staff, both specialized and support providers. Moreover, the current medical imaging solutions can only diagnose the diseases in late stages when there are limited options for treatment. Furthermore, these methods rely on clinicians' experience and perceptual abilities, which are highly prone to errors and can lead to high misdiagnosis rate. And finally, inadequate post-operative care for discharged patients at their home, and intermittent monitoring, which can lead to avoidable hospital admissions. So in order to address the current unmet needs of the health practices, smart technologies are being deployed by digital hospitals at every stage of care delivery, aimed at improving the patient experience and reinforcing patient centricity. The use of these technologies before, during, and after hospitalization have helped in providing a good all-round experience for the patients and facilitated cultivation of long-term relationships. So over here, we discussed some of the technologies that are being deployed in the patient care during the 3 phases of care delivery. So the first phase is the pre-hospitalization. So as a patient, you can interact with text and voice-based AI assistants available on the hospital's website, which analyze your response for symptoms exhibited and accordingly suggests appropriate doctors for consultation. Furthermore, the hospitals also provide you with virtual appointment scheduling platforms that enable booking of appointments with clinicians in more or multiple departments, aimed at improving patient workflow. Now, the second stage is the hospitalization part. So once you enter the digital hospitals, there are a plethora of technologies that are being deployed. Now, right from providing turn-by-turn navigation to allow you to find specific departments or doctors, to real-time location systems based patient tracking platforms that help monitor patient movements. Yeah, so during the pandemic, what we have observed is there are some notable technologies that have received immense importance. Now, some of them are AI-based medical imaging systems, like that of Cure.ai that has developed a QRA solution for Bolton NHS Trust Foundation, which helps in precise highlight abnormalities in patients' medical images for accurate and early disease diagnosis. Then you have the healthcare robots developed by companies such as Zenex, that has been used in Sharp Hospital for disinfecting patient rooms. And finally, the remote patient monitoring platforms, which Caleb will be discussing. But let me highlight some of the examples that has been deployed. So one of the use cases is of current health wearable monitoring system that has been deployed by Mayo Clinic, which helps facilitate continuous bedside monitoring of inpatients' health vitals, both in ICU and non-ICU settings, providing health professionals with early signs of clinical deterioration in patients without causing any discomfort to them. Now, the last stage of care delivery is the post-hospitalization part. So there are technologies such as remote patient monitoring tools for continuous monitoring of at-risk discharged patients, monitoring their physiological parameters, just to check clinical deterioration so as to reduce unnecessary hospital readmissions. Then you have these telehealth solutions for conducting video or phone teleconsultations with patients recovering from their surgeries. And finally, the mobile-based care management applications that enable follow-up care, such as medication regime or diet to be followed by patients post-discharge. Now, in addition to providing optimal patient care, digital hospitals also use smart technologies in non-patient care areas for improving facilities efficiency, air care preparedness, energy use, and seamless tracking of medical devices and supplies. So just to give an example, the first is the AI-based centralized command centers deployed by Advent Health in partnership with GE Healthcare. So it uses the preliminary findings gathered during the admission of the patients to provide a list of charts and schedules of tests that needs to be performed. Then AI is also used in supply chain for demand matching, wherein data related to compatibility of medical devices with patients used during routine clinical practice can be leveraged for value sourcing so that the right medical device is available for the right patients. You have the RTLS-based asset tracking systems for monitoring hospital assets so as to improve their accessibility, prevent any thefts, and cut down additional expenses or additional assets. There is the evidence-based architecture that uses circadian lighting and acoustic ceiling tiles and wall panels for improving sleep, lowering blood pressure, and stress levels in the patients. And finally, the IoT-based energy management systems, which use the smart sensors so that the energy consumption for heating, ventilation, air conditioning within the patient rooms can be automatically adjusted based on the occupancy. So this helps in enhancing patient satisfaction, while hospitals can improve their operating margins through optimized energy use. The final thoughts I would like to state before concluding my presentation is COVID-19 has certainly brought to the fore the immense importance of smart technologies. And now is the opportune time to invest in these technologies so that the hospitals can truly achieve the quadruple aim of providing improved patient experience, better health outcomes, enhanced staff experience, and lower cost of care. So with this, I would like to end my presentation and thank you for this.
Thanks, Neeraj. That was super interesting. And now both you and Paddy have mentioned remote patient monitoring as one of the key innovations for smart hospitals. So I think that's a great transition to Caleb's presentation on remote health monitoring.
Marianne, thank you for the introduction. And of course, I'm going to be pretty succinct with my section here. I'm sure we can dig into more of this on the panel discussion, and folks would probably find that more interesting than me talking overly at length about all the things that Virtusense does and that we're doing to transform care. But I'll just give kind of a high level teaser, I guess, of what we're up to in the space and some of what we're seeing. Virtusense, I should probably start, we're an AI company that began with a mission to, our founder had a really negative experience, a bad outcome for his grandmother, who actually suffered a fall, passed away. And he wanted to take some of his learning and experience working in machine vision, machine learning in the government space and in the defense sector. And he thought that there was a lot of opportunities for healthcare to become more predictive rather than reactive. And so that's kind of our focus here at Virtusense. That's where our mission was born from. And so we're developing sensors and machine learning platforms and all sorts of things to help health systems and healthcare as a whole go from a reactive kind of model to a predictive model. And especially as we get into systems of reimbursement that incentivize outcomes, the more the provider can predict ahead of things occurring and prevent them from occurring in the first place, the better for patients and certainly the better for the bottom line. There are a lot of reasons why healthcare is slow to innovate, and certainly, we've encountered all of the ones we've listed here across our health system partnerships. It doesn't matter necessarily if you have, as a technology provider, if you have a better way of doing things. You have to, the reality is that clinical leaders, clinical partnerships, it takes time to overcome. There's a change of philosophy, a change of approach. I think, telemedicine and the pandemic and kind of what we've seen as a shifting attitude and landscape of how care is delivered remotely kind of reflects that. I know a lot of providers, I still see providers talk with resistance and kind of hesitancy of the implementation of telemedicine even post the pandemic. But I think, sometimes the reality is that innovation is often driven by necessity rather than this is the right time to do it and we should be forward thinking, we should start innovating some of these solutions. It's really driven by, oh no, now we're in deep trouble and we need to do something. So we're going to do the thing we probably should have done years ago. And so I think that certainly happened with telemedicine, and remote patient monitoring is included with that. I'll just give kind of a brief analysis of what we've seen for, in particular, some of our partnerships with health systems. We have one technology that is used to predict bed exits and to prevent bedside falls in the acute space as well as in long-term care. And this technology it's not expensive. It's actually, a lot of hospitals, I worked at University of Michigan Hospital before I joined with Virtusense, and a lot of hospitals are still using actual people, sitters, in-room sitters, to monitor patients, to observe them, or if they're using some sort of video monitoring, kind of remote split screen kind of telesitter program or something. And these programs are not inexpensive. They cost a lot in manpower, they cost a lot in IT, and some of the outcomes associated with those programs are dubious at best. But this technology, I think in the last year, what we've seen with one of our partnerships here in the Midwest, and they're releasing an IRB on this shortly, is pretty tremendous outcomes in reducing falls. We use a sensor that basically uses AI, no video. It recognizes when the person's attempting to get up and notifies nurses ahead of that attempted bed exit that they're getting up so they can respond before the patient suffers a fall and ultimately provide whatever their needs are, get them back in bed. A lot of these folks are medicated and confused, or some of them are older. And so it's a really simple process. It's actually, the technology behind it is not quite so simple, but the actual delivery of the technology and the way it works in the hospital is pretty simple. And the results have been tremendous. It's resulted in a 78% reduction in falls in this last year. And we're really excited about that, and we're growing the partnership there. One of the kind of things that emerged from the pandemic that a lot of our hospital partners started noticing is that as they had to isolate patients due to infectious prevention protocols, their falls and incidence of falls were going up. It was more and more difficult to see patients. They're having to close the door. Surrounding was becoming difficult. They were discovering patients on the floor long after a presumptive fall had occurred. So having a kind of an assistance, having technology there to augment staffing became increasingly important. And I think some of our partners, it really accelerated the conversation for us, because there were a lot of folks that said, hey, we'd love to do this, but now is not, we've got a lot of other priorities, competing priorities going on. Now's not the right time to implement this. And then as the pandemic accelerated and these falls were increasing and staffing was becoming increasingly difficult for some of our health system partners, their desire to innovate and to adopt and to move forward with this technology, we noticed really kind of picked up. And a companion to that, and we don't have I unfortunately don't have information yet to share kind of on the outcomes of this partnership, but our goal is to take kind of our existing platform of predicting and preventing falls and expand it to predicting and preventing adverse events of all kinds for patients, both in the hospital itself as well as extended into the home, as kind of Paddy mentioned. So we have a vital monitoring patch that's FDA approved that our hospital partners are using in their COVID wards. And we have a large health system partnership in Missouri that just launched with this last month. And what their experience was, and maybe kind of what I want to highlight specifically, and then I'll wrap up my portion here, is that it's too late to innovate when you're desperate and when you're realizing that you have a problem that's emerged. It's often you're kind of catching up to the problem and you're catching up to solving it. An example of that is one of the things that emerged, I think, for a lot of health systems in the last couple of months was as COVID cases began to rise, they had more and more staff members in the hospital, more and more nurses that were contracting COVID, were no longer able to work for a period of time. They're having to source outside nursing staff at exorbitant prices, or they're not able to even get the nursing staff that they need. And right as their caseload is rising and their census is rising in the hospital, their available providers, their available caretakers is going down. And so this is where, technologies, and there's other solutions beyond ours, of course, but technologies can help augment that challenge of if you're looking to, if your current workflow and process is sending a nurse tech in every couple of hours to take vitals, it's potentially worth looking at a solution like ours or other solutions out there that will monitor those vitals remotely and continuously and reduce exposure between both the patients as well as the nurse staff that are working in the hospital. And technology is not cheap. It's not free, it's not inexpensive, and oftentimes, unfortunately, reimbursement is behind in the landscape of innovation. So CMS is not exactly out on the cutting edge looking at how they can best reimburse and incentivize health systems to adopt the very best and latest in innovation. However, when health systems consider all of the auxiliary costs and especially staff and the implementation of technology and how it can help augment that staffing and reduce some of the costs associated with it, that's really where we're almost through, I think, probably the worst parts of the pandemic, I would assume, and hospitals the vaccine is rolling out and hospitals are recovering. So this, the COVID conversation is going to wind down. But the question I have for our health system partners, and I think the question that needs to be asked as a part of this conversation is, what is the next crisis? What is the next thing, and how are you innovating to address that? Is it the addiction landscape the addiction health and mental health crisis going to emerge post this pandemic, and what are providers doing with technology and innovation to help address that? How are they expanding their remote patient monitoring programs into in their hospital, into the home and beyond, and long-term care, and kind of the need to coordinate care across those different care settings and environments? So I'll just kind of conclude with that as an open-ended question. I think, you know, the COVID thing is very much a part of our conversation still, and it's an important talking point. But this crisis will end, but it won't be the last crisis. And so I think that that's really one of the important things to emerge from the conversation is kind of to Paddy's point, you have to have a plan in place. Where are you going and why are you going there? And how are you going to, in the steps you're taking today, how are you going to solve tomorrow's problems?
That was really insightful. Thank you so much, Caleb. And we can talk a bit more about the challenges you've highlighted in the discussion. I think Justin is going to talk about real-time location technology to improve patient experience and optimize operations.
Awesome. Thanks, Marianne. The insights so far from everybody have been fantastic, and I'm really excited for the discussion. Before we jump into that, however, I want to share a little bit about my company, Pointr, and how we see technology evolving in healthcare. So we refer to Pointr's technology as a deep location platform. It enables our users to enhance experiences and operations through our location-based services, analytics, and engagement. In specific, we're utilizing Bluetooth Low Energy in a combination with our 10 patents to deliver a solution that we find to be best in class with both accuracy, performance, and scalability. The platform has been deployed in over 1,000 buildings, as you can see here, 18 countries. It hosts 2 million unique daily sessions, and our clients span a number of different industries, with, of course, healthcare being central to our mission. In specific, we work with UC Health, having deployed at their Aurora campus in Colorado. We also work with government agencies like the Department of Homeland Security, major airlines such as Delta and United, and other industry leaders in retail, Nikes and Harrods, in the commercial office space, CBRE, KPMG, EY, and the likes of them. But I'm going to dive a little bit deeper here on UC Health. This is a massive campus, just simply put. It's 12 buildings, 60 stories, and I believe it totals about 2.5 million square feet. And so you could imagine that poses a severe navigational problem. Patients were anxious trying to get from one appointment to the next in this maze of buildings. And as a result, their experience suffered, anxiety increased, appointments were often missed or started late because of it. UC Health ID'd this problem and they found a solution. However, after about 3 years of middling performance, they ended up going back into the market in search of a higher performing provider. And that's where Pointr stepped in. We provided them with complete digital mapping for this entire venue, indoor and outdoor navigation. We tied into their existing MyChart mobile app, and then we deployed this solution at a fraction of the cost of the previous vendor. There's more to come from this partnership, so keep an eye out. But what I'd love to provide is an overview of what we think are the 3 pillars for this platform in healthcare. It's enhancing the patient experience, like we just spoke about with UC Health. It's improved hospital operations, and it's aggregating all of that space utilization data to empower smarter decisions about your venue. So on the patient and visitor side, we view this as the digital front door. And it's corny, but like any good front door, our SDK fits snugly within your existing mobile application, iOS, Android, MyChart, as I mentioned. And today, most patients are already receiving appointment reminders on their phones. So from there, the patient experience takes flight with our platform. As mentioned, we're digitizing your venue or working with your existing mapping partner. We're adding searchable points of interest and putting that venue in the palm of your patient's hand. Through the use of geofences, our location-based technology enables patients to digitally engage with your venue through things like contextual notifications or promotions. And most importantly, Pointr navigates users directly to their appointments or desired destinations. Our dynamic navigation seamlessly transitions between indoors and out. It provides accurate floor level detection and even offers, as you can see here, Find My Car functionality, tying a bow on the entire patient visit experience. This wraparound digital experience has been shown to help reduce missed appointments, which amazingly happens on average 15 to 30% of the time. With appointments front of mind, the average 350-bed hospital stands to reclaim around $240,000 annually. Now, on the staff front, we can take that same experience-enhancing solution and also support improved staff operations. It can be made available on most handheld devices like Zebra, Honeywell, and others. So digital mapping, wayfinding, Find My Car, and the panic button functionality also helps reduce staff anxiety. But in addition, asset tracking has been shown to play a major role in efficient operations and cost savings. In specific, think about the amount of downtime spent for equipment plus the amount of time spent by staff looking for that equipment. And we're looking at the average 350-bed hospital losing almost $1.2 million a year just due to that efficiency loss there. By implementing a solution like Pointr, the technology enables staff to, one, search for specific equipment on their handheld device, two, get the exact location of said item plotted on a digital map, and thirdly, they can opt to receive step-by-step directions to the nearest available option. So all in all, there's better utilization of expensive equipment, there's less money spent on rental equipment, and staff is able to host appointments more efficiently. So it's a win across the board. Now, aggregate all of that location-based data from patients, staff, and equipment, and then present it on our UI, and that's the Pointr dashboard. Your administration is now able to see the venue like never before. We're looking at KPIs like occupancy count. We're using dwell time and footfall to capture how space is being utilized, not only on the whole, but also down to the day of the week, the hour of the day, and the specific room. We're also helping you use heat maps to visually represent patient and staff congestion points, zonal analytics to clearly define that space utilization. And then last but not least, if you're combining this information with asset tracking, you're unlocking what we refer to as cleaning monitoring, which really helps ensure that the rotations align with venue traffic, keeping your space clean and sanitized. Now, whether this information is hosted on our dashboard or integrated with your existing data repository, you're unlocking the ability to make data-driven decisions about site and operational modifications. And again, where each bed can represent as much as $100,000 annually, this improvement has tangible ROI. So I'm going to wrap things up really quickly here, as if the three pillars of patient experience, improved operations, and space optimization weren't enough. We're gamifying wayfinding with our native augmented reality feature. We're automating map digitization with map scale so your venue stays up to date. And we're adding location-based analytics to your data lake, as I mentioned, to fuel not only decision-making, but also AI learning. And last but not least, we're hardware agnostic. Our BLE compatibility works with most Wi-Fi access points, smart lighting, and beaconing. What that means is that we're able to scale in kind and in step with your hospital's expansions. So these are the things that we're really excited about, and we've seen hospitals adopt as a result of the technological transformation because of the pandemic. And I look forward to handing this back over to Marianne and diving deeper on some of those topics in our discussion right now.
Thanks, Justin. Well, my first question for all of you was actually how has the pandemic impacted demand? But you all answered to this question in each of your presentation, which I think is very interesting. I think Paddy and Neeraj, you agreed that there has been an acceleration of demand for digital technology. And Caleb, you mentioned that hospitals have had a slow adoption in the past, but that it needs to change, and they realized that with COVID. Is that right?
Yeah, no, I think so. I mean, it's like all of us, right? It doesn't really, it's not a unique problem to healthcare. We don't really want to change. Human beings don't do a great job of changing until you kind of have to, right? And so it's easier. Status quo is much easier than doing something new and doing something different. And different is often uncomfortable. But I think if there's a positive to the experiences of this last year, although there's not very many positives, but if there is a positive, there is a tremendous need for innovation and opening up the conversation, really a closer collaboration between clinicians and technologists. Together we can solve a lot of problems, but there has to be an openness and willingness on the technologists to listen to the clinical partners and to the healthcare providers about what they actually need, and not just what some really cool, a couple of engineers can sit in a room and create technology that's really neat, but it may not solve the problems that these folks are actually experiencing on the ground, and the nurses are experiencing in the rooms, and they're saying, what are you talking about? This doesn't make any sense. And we likewise, we need openness and willingness for collaboration from the folks on the ground and from the folks in these health systems about how are we gonna really move care forward.
Yeah, and I think that really that's really what Paddy was talking about with need to assess first. Sorry, Paddy, I can't remember what the other two were. You need to assess, then you need to
design the roadmap, and then implement it. Right.
And
Yeah.
do you see hospitals working closely with tech startups and digital innovators?
Yeah, this is a very, very important aspect of our work, as well as an important aspect of digital roadmaps for health systems. Today, I think most health systems acknowledge that they need to find a way to harness the innovation that is available now in the digital health landscape. The challenge for many health systems is that they don't know how to go about assessing many of these startups, assessing the risks involved, integrating them into the environment, and then scaling them for enterprise level adoption. Most health systems don't have a playbook for doing this in a reliable way. That's one part of it. The other part of it is, of course, what is important to one health system may not be important to another health system. So for companies such as Pointr or Virtusense, it becomes very important to understand who is really your target audience, who is likely to implement a wayfinding solution with all the advanced features that a company like Pointr has. But I do like the platform, and I do like everything that Justin showed. I love the interactive features, the 3D, the augmented reality enabled mapping, and of course, all the analytics. And I can think of at least one way in which health systems can take advantage of all these analytics capabilities. Today, if I link it to what COVID-19 has imposed on us, it's a need to take a new look at all of your existing workflows and your patient experiences, whether they're online experiences or the in-person experiences. The way patients are going to engage with the physical environment in the hospital today or a clinic is going to be a little bit different from pre-pandemic, because I don't think we're going to get over our fear of coming in contact with people or surfaces in a high-risk situation. And I don't think we're going to get over our hesitation to be in crowded spaces anytime soon. So with the help of your analytics, I think there's a great opportunity for hospitals to really maybe decongest some of the rooms where you think there is a congestion issue, or completely review the way your physical space is being utilized today. And you might find out that there are some parts of your hospital, physically speaking, that are vastly underutilized today relative to pre-pandemic era. And that might give you opportunities to reuse your physical space. So I think there's tremendous opportunity. I just want to make one more comment. Our digital maturity assessment model that I talked about is broken out into 6 sections, and it's got a bunch of different questions. There is a very specific question we ask about wayfinding in our assessment, because we believe that adopting a wayfinding tool is one of the many ways in which you're really improving the inpatient experience for not just the patients, but also for their extended family, their friends, and also for caregivers. Mm-hmm. So I think there's tremendous opportunities ahead. The key is going to be to figure out where it all fits within your roadmap. Is it a year 1 priority? Is it a year 2 priority? And then you make the appropriate investments.
I 100% agree with that. And one of the use cases that we've heard is exactly right, not just patients and visitors, but staff. These hospital campuses can be so large that it can be really cumbersome for, to Caleb's point, a visiting nurse getting acquainted, and there's all this downtime. And I think where we all agree is a lot of the technological innovation has happened in the regards to remote access or contactless experience when it has to be in person. I think one thing I'd like to layer on top of that too is the timing constraint. I think that there's going to be there currently is a lot of pent up demand. And I think the second half of next year is going to be a bit of a surge. And I don't mean that tongue in cheek, but I think a lot of people are having these conversations right now, and there's an inability to take steps forward because of restrictions on site, uncertainty about what the next new technology from a startup might be next quarter. And so I think it's going to be a really exciting conversation for the healthcare systems, people like myself, Caleb, Paddy, Neeraj, and understanding what the second half of next year looks like from an implementation and deployment perspective.
Oh, that's really interesting, and it brings us really to the ROI of such technologies, and how do you do a financial model that makes sense? So I think Caleb, you were talking about reimbursement that prioritizes outcomes. Do you want to expand on that a little bit?
Yeah, sure. I mean, so our RPM, one of the things that we're doing that's innovative and is kind of taking RPM to the next level. RPM is designed currently in reimbursement around remote patient monitoring programs is designed less to reimburse for a continuous picture of a person's health and is more so instances or moments of care, check-ins, monthly or weekly check-ins with a nurse practitioner or a physician over the phone, and then doing some vitals and that sort of thing. One of the things that we're seeing, the CMS is releasing increased reimbursement for RPMs and new codes associated with RPMs, and there's a movement towards, I think, an awareness of that currently a patient only has, a health system only has a very small window into each patient's healthcare and journey, and especially social determinants of health across the year. You may only have that person in the doctor's office a couple of days a year. They may have been hospitalized a couple of times. You have a very fractional window into kind of their overall health and circumstances. And especially if you're accountable for their care, if you're in a paradigm where you're accountable for their care and rehospitalizations is affecting your bottom line, that's significant. So I think what's happening is RPM programs are quickly, and the reimbursement around RPM is expanding to incentivize more frequent, kind of taking those snapshots of care and creating kind of a motion picture of a patient's life, a more coherent kind of analysis on how they're doing, and getting all of this data and information about trends in their health and behavior that's ultimately going to affect flare-ups in their chronic conditions and readmissions to the health system and some other adverse events that these folks can face if they're not headed off. I think in the hospital itself, what we're seeing is, there's not necessarily a lot of reimbursement around putting a sensor in the room to prevent a patient fall. But what there is there's a defrayment of the current costs that they're experiencing as a part of that. It costs about 20 times more to pay someone to sit in the room versus using a sensor to predict a bed exit. It's about equivalent of a cost of the pressure pads and bed alarms that these health systems are currently using. That is kind of the widely known dirty secret of the industry, that they don't work, that they're noisy, that they damage the patient experience, that staff hate them, and more often than not, when they're going off, it's already too late, that they're basically just notifying you that the person fell on the ground. So I think the conversation is quickly evolving and emerging. There's new things, and the landscape around telemedicine and RPM is changing quite quickly with reimbursement. Probably not quick enough, especially for CMS is probably always going to lag a little bit behind in that landscape, and insurance providers as well. But I think the good news is it's getting better, it's improving, and there's a growing awareness to incentivize behavior that is going to lead to better outcomes for patients, and to reward that behavior with billing mechanisms and things that health systems can utilize.
I think that's great. And my perspective here too is that right now, so much of the healthcare's data is tied to a lot of electronic health records. And my perspective goes kind of back to Paddy's point too, which is every hospital, every campus, every system has its own unique patient demographics, layouts, just strengths or weaknesses. And so the more data that can be layered on top of those records is going to put each one of these hospitals in a position just to provide improved experience, better operational efficiency. And again, it might be wayfinding, that's the big unlock. It might also be patient monitoring, that's the big unlock. But realistically, right now, just additional information enables them to make the best decisions for their patients and their staff.
And just to add the point regarding this connected devices, there is an enormous amount of health data that has been generated, and you need to have this power to utilize this data to provide better outcomes. So harnessing this will help in providing a more productive ways of delivering care. So just elaborating on Justin's point, during my research about these digital wayfinding solutions, what I have observed is harnessing that data about collecting the patient's movements during their stay in hospital. The devices can be customized to understand what are the critical points or dead zones in hospitals where the incidence of falls or slips can occur, or fire exit points where there are emergencies can occur. So the hospitals can recognize these points and provide more of a proactive approach to avoid these kind of situations, so as to ensure that patient safety is the paramount point at this point.
Paddy, I wonder if I can ask you a question. You clearly are a leader kind of in this space, and you're helping health systems make intelligent kind of transitions to adopting innovation and technology to improve care. I've seen in our conversations a growing and shifting interest away from brick and mortar care to how do we provide care in the person's own home? How do we decentralize the hospital to, what does it look like to do the hospital at home versus, kind of our traditional expectations of you come in for care versus care comes to you. What have you seen? Does that fit? Is it your conversations with the health systems? Is that kind of aligning with what you're seeing in the space? Is that where most are heading?
I think broadly speaking, and I can speak about my own views on this based on everything that I'm seeing and hearing. The healthcare services is shifting away from predominantly a location-based in-person experience to a more of a sort of a fragmentation of the experience into three broad components. The first component is online experience. So the way you access care and the way you receive care, especially for primary care and certain other ambulatory care needs, it's all going to be online, and you can use a lot of remote tools and virtual consult platforms and so on to accomplish that. The second component of it is going to be home-based care. So where care shifts from the hospital to the home. So a lot of the care that today requires you to go into a clinic or a facility can conceivably and practically be addressed in a home-based situation. And we're going to see a significant shift towards home-based care in that context. And the last third is going to be in-person care inside a hospital campus. And that's going to be all of your acute care needs. So we're not going to see that go away. The brick and mortar is going to stay. I can't imagine that you're going to have a heart transplant or something like that. I take an extreme example, but you're not going to have an acute care procedure taking place inside a home. You're going to have to come into the hospital for that. But if all you're looking for is a checkup, you had an acute care procedure, you were discharged, and you're in rehabilitation, and you need to check in with your doctor. You don't have to drive 1 hour. You're a single mom with 3 kids. You don't have to drive 1 hour to do a 15-minute appointment. You just do a virtual care, virtual consult. So I think it's going to get broken out. Again, I'm breaking it down neatly into thirds. That may not be the way it happens, but those are the 3 components that I see healthcare services breaking out into. And where your product or service or solution fits is going to be a function of the specific marketplace in which your targets or your clients operate, and whether they feel the need to really adopt and embrace all 3 modalities. And to me, if you look at the top 50 or so or 100 or so health systems, they are adopting all 3 modalities today. And the marketplace is now beginning to favor the digital first companies. So you're going to see a lot of new entrants coming into each of these spaces. Now, the more traditional in-person acute care facilities, you're not going to see a lot of competition. I don't see an Amazon, Microsoft, or a Google setting up a hospital for cancer care to compete with an MD Anderson. I don't see that happening. But do I see them competing in the primary care space, especially with online consults? Yeah. Do I see them competing in the home-based care space? Maybe. So it remains to be seen, but I think that is where we're headed.
think that's super interesting insights. And I think we actually had a really great discussion. And I hope it proved useful to our healthcare CIOs who've been listening. I'm afraid we need to wrap up because we've gone a bit over time. But I just wanted to say thank you to all of you for your great insights. If any of you who listens in has any question, you can ask them on the chat boat and the speakers will reply to you as soon as possible. I wish you all a great day and take care.